After taking this course, I feel like I've already started implementing the knowledge gained from this course information into my career and personal life. But after completing the full course and all of the coursework, I will use a lot of the information gained in this course for coaching as a soccer coach, and I have been a soccer coach for 3 years now. It's a lot easier to kind of make a quicker diagnosis on injuries just because I know a lot of the anatomical knowledge that I have gained from my previous classes, but also this class especially, and implementing the functionality of the muscles, bones, and joints. So helping the players that I'm coaching, as well as myself as a soccer player in college and my teammates, kind of get that quicker diagnosis on injuries, but be able to know more ways to prevent and treat each injury. When it comes to my personal life, I feel like a lot of anatomical information is helpful just for like good knowledge. Like I said, as a soccer player, like that has been my personal life since as long as I can remember. So just being able to kind of make quicker decisions based on it, and like how to manage my pain, because an athlete, there's a lot of injuries that occur a lot and a lot of accidents that can happen, but being able to know the knowledge of a lot of more bones, joints, and muscles, especially muscles as a soccer player, is super helpful in determining what I need to do for prevention, rehabilitation, really anything like that. When it comes to my 3 biggest takeaways in this course, it took me a while to think of this just because there were so many takeaways, even though this course is only 8 weeks. The first one would be gaining knowledge of the difference of muscle use per sport. When we did a discussion about the difference between like muscle movement in baseball players, it really was eye-opening to see like how different muscles are incorporated more per each sport. Obviously, leg muscles are going to be used more significantly in soccer than, say, basketball, I would say, just because you're covering a longer distance and it can be a lot more severe because there's obviously less arm muscle movement in soccer than there is basketball. So that's for the first one. For the second one, the knowledge of how to prevent injuries and where injuries occur most. So in soccer, a lot of the injuries would be ankle injuries, foot injuries, hip injuries, as that's what I'm experiencing right now. So just being able to have those prevention tactics and use the prevention tactics that I would use for soccer rather than how another athlete for another sport would use them. So just how to prevent your injuries better and take the right steps in order to come back from an injury. And then the third takeaway that I'd say I gained most from this course would be just the overall knowledge of information that I've learned about the body and how you can treat injuries based on which part of the body that is significant in that injury. I feel like just knowing like if a certain injury is anterior, posterior, lateral, medial, just being able to depict the difference of it, and knowing that there are different prevention and rehab tactics that can go hand in hand no matter what anatomical phrase is being used. And I also have been able to understand more of the knowledge that I have been going through with my injury of a torn labrum. So when I saw my MRI results that it was an anterior, superior, and a posterior tear, I had more of an understanding of what that was instead of just having it be random vocabulary. So that's definitely a big takeaway, and I will continue to use that throughout my career working in sports as well as a coach. Thank you.